Hey, listen, from Kris Jenner's facelift to Simone Biles' breast augmentation, celebrities change the conversation around plastic surgery in this year, 2025. Transparency is in, stigma is out, and cosmetic procedures are way more mainstream than ever. What could possibly be next? Plastic surgeon, friend of the show, Dr. Smita Ramanadham joins us in our The Doctor Is In segment to reveal the biggest plastic surgery trends to watch out for in 2026. First of all, happy holidays.
Happy holidays. Thanks for having me.
I think the trend is going to be whatever you're doing, like you specifically, because you always look fabulous.
Thank you so much. Yeah, we're so excited about 2026.
Are we? Because
we are,
I have to tell you, I was the last person to realize that Simone Biles had breast augmentation, and I don't know how, because everyone was so transparent, almost brandishing it like, yes, I had this done, and here I am.
Right. People should own it, right?
Yeah.
It brings new confidence, self-assurance. So we really love that about 2025. I think that's carrying on to 2026.
Okay.
But we're seeing this new shift from bigger was better to less is more, right? So more subtle results, more natural results, which I love because that's always been my aesthetic and my practice.
Right.
But that's what's going to give you the longevity, those long-lasting, really beautiful, elegant results. We're also seeing a shift in the demographic, so younger patients, millennials, Gen Z, and even men. More men are getting plastic surgery as well. So it's an exciting time.
I mean, I hear men talk about plastic surgery more, so all right, let's break down and talk about the face and the neck.
Yes.
Right? The nemesis of any aging woman.
Yes.
What are we doing?
Yeah. Well, I think, again, we're seeing more of a shift towards the surgical aspect. So more facelifts, more neck lifts versus the fillers and that overdone look. So patients are a little bit younger. When we first start to see early signs of aging in our 40s and 50s, people are choosing to get facelifts. And the key to that is, you know, whether you're doing a deep plane or some sort of manipulation of the underlying structures, it's not just about the skin. That restretches.
Right.
So you really want to tighten from below to give you those more natural, subtle results.
Right.
So it's, you know.
So it's that. I had a friend in high school, her mom, I swear, in my mind, she was 60, she was probably 30. And she had a facelift, but she was like, I have to do it now because I don't want to one day wake up and everyone's like, oh, she got work done.
Right.
Unbelievable.
You start early.
Start
That's
early.
The way to do
okay.
It. Yeah.
I need to start a bake sale. Okay, BBLs.
Yes, BBLs. So BBLs are
First
still.
First of all, what does BBL stand for?
Brazilian butt lift. Yeah, so fat injections into the buttock. We're definitely seeing less of that, but it's a shift. So again, it's less is more. It's more about creating more natural curves. So redefining the waist, maybe adding a little bit of fat in the buttocks just to give you a little bit of some roundness and plumpness. But we're still seeing BBLs, breast augmentations as well.
I feel like that's something that's going to be around till the end of time.
It's going to be around, but we're seeing a shift in it, you know. So whereas in the past it was bigger breast implants, recovery time, downtime, all of that, and now there's a shift towards more minimally invasive breast augmentations, which is exciting for us because we haven't really seen a lot of innovation and technology in the implant space until this coming year. So, you know, we're bringing in new demographic of women that would normally have never considered a breast augmentation because they're busy, they're working, they're moms, they can't take the downtime. But now there's an option to do it under local anesthesia, smaller incisions, less recovery.
Breast augmentation on your lunch break?
Yeah, stay tuned. 2026 is going to be an exciting year.
Are you still going to use the chicken cutlet things? Or? That's you know what, you're a dermatologist, I'm not. Those things, those jelly things.
The implants.
The implants.
Yes, but smaller implants. Smaller, more natural, softer implants.
Interesting.
Yeah.
Okay.
Yeah.
Preventative rejuvenation.
Yes. Again.
Explain that, please.
Yeah. So women are starting younger. Men are starting younger. Whether it's, you know, a shift from fillers and that sort of overdone look to things like Sculptra, where you're building your own collagen. You start early, so you do a little, I call them tweakments, right? You start in your 20s, 30s, when you first start to see signs of aging, you're losing collagen and elastin in your skin. And then you can do these small treatments over time to kind of just age gracefully. The goal, the goal is not to stop aging.
Right.
It's a blessing to age, but it's age gracefully.
That's
right. The key.
Here, here.
Yeah.
Last but not least, we've talked about men. Are we going to see more men?
Absolutely.
Doing some of this stuff?
Yeah, and I see this in my practice too. There's more men, and a lot of times it's in those more competitive fields where they're competing against 20 and 30-year-olds, the tech space.
Welcome, gentlemen. Welcome to the show. Hello.
Exactly. So they're coming in, they're getting Botox, they're taking care of their skin, starting retinols, even a little bit of filler, and maybe opting for eyelid lifts or facelifts a little bit earlier than they would normally. Yeah.
I can't wait for this shift.
Exactly.
Cannot wait. It is always a pleasure to see
So
you.
good
Thank
to
you
see
so
you.
much, Dr.
Thank
Smita.
you.
Happy holidays.
Happy holidays.
You at home, for more information, follow Dr. Smita on Instagram at the Dr. Smita.